Hello, guys. So this is the demo about the inventory, how we can manage that. So let's see. We just take an example, right? So we have related purchase order, repair orders, right? And replace order are there, right? If there is any replacement going on, and even the write-off. Write-off means that we want to send back, uh, right? And the inventory transfers for one product, we are moving to another location to the same branch, right? So we are talking about the product inventory. So for example, for the KD hospital, which is in Ahmedabad, and which is quantity is 400, and so on, depending on what product is there, right? So you get the basic ideas of how many inventories are there, right? So one of the product inventories will go in details. So suppose example of one of the KD hospital, right? So in this KD hospital, the location that we have selected, right? So they have 400 in quantity, wheelchair, ventilators, and many others, right? So location may differs, right? So in the purchase order, uh, so we are looking for a new locations, right? So we can click on the new and the product that we select, that is wheelchair. Example, the location might be Ahmedabad or Jaipur or anything. We can add the quantity and the initial status initiated, right? So once that is done, so the purchase order has been created, right? So here, if they, that needs to be verified, submit for approval and all, right? So we click on that and yep, comments that this needed on an urgent basis and click on submit, right? So this goes for the approval process. You can see in the approval, it says pending, right? And you can also, if I'm the admin, so I can go ahead and approve that, or you can reassign to some other person, right? Uh, so probably I can have approved it with the comment approved, right? So yep. So now the status says approved, right? And we can also here we can run the automation and we can share the email to inform the party, the person, right? And who will put that particular order, right? So once it is completed, you have to click on that, and if you click the status, it is completed, right? And when you go to the product inventory automatically, so you would see the product inventory has been automatically updated. And if you go click on the replace order, now in replace order, you say the product is ventilator example, right? So we have taken the replacement request for particular location, right? And in write-off, write-off means like we need to if that is not useful, we want to send back. Is there something defect or something? So when the write-off is approved, the replacement has been done, and we have shared that write-off that we don't need this. We can click the status here completed. Right now, that comes as a scenarios inventory transfers. Right. So now example with the KD hospital exactly. Right. We click on the one of the inventory. So here we can status shows initiated. Right. In the same flow it goes. Right. Uh, so someone from the dock manufacturers from and the current location is Ahmedabad, the KD hospital. So what that is approved and is initiated, so we can do the completion, right? And just click on save, and that has been completed, right? The inventory transfer goes. So now the inventory transfer means it might be from one hospital to other location hospital, so that also goes. So now we talk about the dashboard. So guys, I'll be very quick. So yeah, in the dashboard now, if you check the dashboard, how it looks like. So here we have selected the location bar and the product bar, right? We have did the filtration, and now we can see the new purchase orders, products, the quantity status, how many products a hospital has, right? And and what is this inventory transfer status, new purchase charts, inventory status, and you can also see the product inventory as well, right? And incoming inventory, outgoing inventory, right? So these incoming and outgoing are the inventory transfers. So in the location bar and the product bar, so if I take in product contains ventilator, only ventilator in the product, so how you would find that? So all the graphs will be automatically updated, right? On the behalf of about only the ventilator, which contains ventilator, right? So if you go on, little on in a particular top. So you would see, the you could see the ventilators, new repair orders, new replace orders, new purchase orders. Only ventilators been showing. Now, if I select one of these location bar, like if I take an example of KD hospital contains a ventilator. So see, there the changes again happened right on the dashboard. So this is how it is updated, right? And in KD hospital, suppose you want to see all the inventories, all the products. So this is how it will look like, though the dashboard is taking a little time. But yep, so this will take and give an idea about the inventories and so on, replacement required. Everything is there, right? Write off transfers, and every update that you make that will show in the product inventory, right? Which is the background. It's working as an automation is working, right? So this is how you manage the inventory. Now let's talk about the care, care coordinators, right? About the patient tracking, right? So for here we create a different application for an app exchange. So not sorry, sorry, not sorry, in this app launcher. So we have created a different app. Now this is all about the patient care, right? The care coordination, right? So this is how the patient navigation looks like on the left hand side. You see the patient card. Now the basic details between that you see all the basic details, right? Even the location where exactly the patient resides. Right. This is very fantastic. Right. You can customize, you can customize the patient cards, right? Health cards, how critical, how, health conditions they are. Are they within allergies, high, medium, low, what exactly it is. You can figure out the patient's card, right? And so this is called the clinical data, right? So in clinical data, you can see many assessments, healthcare provider. Healthcare provider means insurance or any medical claim that you have done, right? And some of the assets of these particular this particular patient, right? So you can also create an assets over here. So what SL will do is that they'll tell you that so it will tell you that KD hospital have 400 wheelchairs and so on, right? How many the patient also would see the tracking of the particular hospital, how much assets they have, what are they, how many they can see the real time, right? Real time basis. And now medical reconciliations there. Opportunities, I would say not. It's not. I would say not need for at this moment. We don't need for the health cloud as of now. It's more towards the sales and marketing, and this is more into the cases. If the case for patient want to report a case. Now this is called a unified health score. Now this health score, you can see the current score for a particular patient, and that can be integrated with the smartwatch as well. You can see the health score, right? And in this particular benefits again, what are the available plans, right, for a particular this, and you can manage those things as well. And this you can also ski appointments as well. As if now there is not, we haven't raised any appointment. So yep, on the right hand side you will see the timeline activity in chatter. So probably in the chatter you would see certain things that anyone has raised, right? They can put it if a patient has put it or doctor has put it. So we can notify to very specific doctor or a specialist, right? Which you can just type, I had connected with this patient. They are looking forward, right, to health care plans, right? And you can just share it, right? Once you share this, so this content, this message goes to that particular person that you have tagged in, right? In activity, you would see all the conversations, might be tasks, calls, everything, right? So what, how many, it goes on the timeline. Now in the timeline, you would say all the chats, all the histories, right? That you've been interacting with doctors, with staff, with ventilators, people, OPDs, everything, which is related to the patient, everything, right? It's all in one place only in timeline, right? It's all about patient, might be inventories, might be anything, right? So so health cloud do have pretty many more features. I'm just showing only the features which is very much important, and we have been might be every hospital needs. And very much more and very much more important, and seriously, And this we have included the chat GPT over here, probably. So I'm one of the patient account like Alex Smith, and they have some appointment coming in, and might be appointment coming in or something they need to interact, right? So you can particularly the person, suppose this patient wants to draft an email appointment confirmation, right? So probably this you can do using the chat GPT. Probably this would help you in giving the proper content, right? Proper message to draft in, and yeah, from there onwards you can pick that particular thing and you can enter it, right? So now it is working. It's so so here it is. Subject is there. So you would have the particular content, and from here you can content and you can draft to a particular person, right? You can send an email. Right. So suppose another thing is that if the person wants to draft an email for billing reminder, right? So in billing reminder, so probably he would get a different content regarding to the billing reminder, and from there onwards, he can raise a request to the accounts team for the billing from here itself. And yep, probably we would have patient community portal from there onwards. He can do the UPIs or credit card, debit cards. He can pay over there itself, right? And you can just directly send from the Salesforce, right? So thank you guys. Have a wonderful day ahead. Meet you again.